My name is Petra Oliva. I'm coming from Archimed Life, which is a medical laboratory based in Vienna, specializing in rare disease diagnostics and niche diagnostics. But my training, training is biochemistry. I have a PhD in biochemistry, and I spent about 16 years working in pharmaceutical field, developing therapies for the rare diseases and rare disease patients. And I also spent some time on a diagnostic program. So the first time we pilot alpha-mannosidoses investigation in MPS negative cohort. It was published 2 years ago, where we investigated about 1,000 cases. We as a medical lab received tests for mucopolysaccharidosis testing. So we received the samples where the physician have suspicion patients with MPS disorders, and we performed the enzymatic testing and follow up with genetics. But there is still a lot of, or there has been a lot of tests which become negative in the biochemistry screen. So we have investigated the prevalence of alpha-mannosidase. So those which being tested negative with the enzyme activity have been submitted for alpha-mannosidase testing. And in our first study, we have identified 4 positive cases within the 1,000 cohort. That brings us to the next level of the study, when we expanded to the countries within Europe and Middle East, and we have investigated close to 4,000 samples. Again, those which are submitted for suspicion of suspicious of MPS, and if become negative in an MPS test, we would test it for alpha-mannosidase. And within that study, we have identified 17 positive cases all around the globe, some coming from the Middle East, some coming from European countries. So the message here is that the prevalence of alpha-mannosidosis within the MPS-like phenotype, it's quite large, and it brings the importance of differential diagnosis to be part of diagnostic program. So as of this study, we also implemented a differential diagnosis, and now each of the samples which is coming for the testing is also being investigated for alpha-mannosidase. So the alpha-mannosidosis clinical presentations are in a way similar to MPS clinical presentation. So the importance is that the physician, I think the most impact it has on a patient. It shortens the time for a diagnosis. The physician doesn't really have to think about all the different scale of diseases to be tested with a certain clinical presentation. And sometimes in some smaller countries or physicians who do not have access to all of the information, that might not even occur that this can be a part of the investigation. So having that in a panel allow the disease to be screened or investigated and the patient to be identified, to shorten the time for the diagnosis. I would say that it is important to think about what we're trying to bring is to have a simplified diagnostic panel. Let's say the biochemistry as a diagnostic panel is always faster, it's always let's say cheaper than large genetic panels, which can also identify a lot of variants of unknown significance, for example. So bringing the differential diagnosis from the biochemical perspective will help the physician to shorten the diagnosis for the patient, help the patient to get the answers for disease which might be present faster, avoid the misdiagnosis as well.